Hi, I'm Hishi.
I'm Sonia.
I'm Claire.
And I'm Jackson.
And we're the Sustainable Sleuths.
Today we are exploring malnutrition in children in the Durham community.
Hi, my name's Hishi, and I chose a spreadsheet because I love being organized.
Hi, I'm Chi, and this GIF represents my ability to multitask in the face of adversity.
I'm Jackson, and I love to research.
Hi, I'm Sonia, and this GIF represents my value of collaboration.
Hi, my name is Claire, and I decided to choose this GIF because it represents my motto of getting the ball rolling.
Our health issue is malnutrition in children in the Durham community, and we chose to specifically look at children as health issues that start at a young age are likely to have lasting impacts manifested in different ways. For instance, there is a cyclic relationship between biological impacts of malnutrition to future socioeconomic status. A study of school-age children who suffer from iron deficiency anemia as infants, which is tied to food insecurity, discovered that these children had impaired memory. In the classroom, these negative cognitive effects can lead to poorer academic performance, which might further lead to less education and lower socioeconomic status. This economic status can then lead to restricted dietary choices, causing poor diets for further and future generations.
As displayed by these graphics, between 1976 and 1980 and 2007 to 2008, in U.S. children aged 2 to 19, rates of obesity rose from 5.5% to 16.9%.
The quote and picture within family and psychosocial factors are representative of how fast our lives move and how we often don't slow down to do important things such as cooking healthy and nutritious meals, especially since fast food is so easily accessible and inexpensive in the 21st century. Also, for parents with many children, cooking can be tiresome and time-consuming, which poses a great challenge, especially for working parents.
Using the IHME's GBD compare, we discovered that for nutritional deficiencies, the DALYs per 100,000 were greater in North Carolina than that of the United States, pointing out that it is a burden in this region.
On the individual level, some determinants include dietary restrictions, allergy, overall motivation, and lifestyle choices. However, we must concede that it's not truly individual determinants that are the cause of malnutrition in most countries, especially those of the lower SDI. This is primarily because children don't have autonomy over their own diets. It is only in countries with higher SDIs do we begin to see some aspects of interpersonally caused malnutrition, primarily vitamin and mineral deficiencies in children. The most common nutrient deficiencies among school children are calcium, fiber, folate, iron, magnesium, potassium, and vitamin E. It has been reported that the two most common deficiencies seen in generally healthy children are iron and vitamin D deficiencies.
Interpersonal determinants of malnutrition in children. One psychosocial factor within this lens is family perceptions on diet. Children are shaped by the environments in which they are raised, and so if they're raised in a home where Southern food, which is usually rich in added fats and sweets, make up a high portion of the diet, that normalizes that pattern of eating for them. So even if money is not an issue, unhealthy eating could become the norm and habitual. Another psychosocial factor is support networks versus isolationist culture. Social connections can help provide monetary assistance, which is a protective factor in obtaining food to help people who are undernourished, or guidance on receiving proper nutrients for people who are overnourished in certain nutrients.
In terms of policies implemented to combat overnutrition and undernutrition on the organizational level, the leading program in the Durham area is called DINE, which stands for Durham's Innovative Nutrition Education. DINE is broken up into the different subcategories of early childhood programs, elementary school programs, middle school programs, healthy school environments programs, adult education programs, and healthy environments programs. Prior to DINE, there were not any major unified efforts to improve overall nutrition and well-being in the area. Durham still has a long road to combat improper nutrition among its residents, but programs such as DINE are certainly a step in the right direction.
Community building and engagement plays a vital role in healthy living and nutritional values. Some important community considerations that affect diets are culture-specific delicacies. Not to mention, within communities, access to healthy foods is often limited due to high prices for produce and financial burdens on families. An important initiative within these communities that can help decrease malnutrition is co-op markets, such as the one located in Durham right off of East Campus. Co-op markets are consumer-owned cooperative businesses that are managed and controlled by the people who use it. For example, at the Durham Co-op Market, small farmers and business owners can sell their goods that are sustainably produced with less of a markup than a traditional grocery store.
Looking at public policy as a structural determinant, we can look at child nutrition waivers, which were issued by the USDA in the beginning of the pandemic, which helped nonprofit organizations adapt to the changes that virtual learning and the pandemic brought on. These waivers were set to end on June 30th, 2022, meaning several summer meal programs would not have been able to operate. However, End Hunger Durham signed on to a national sign-on letter and met with lawmakers to extend these waivers. This shows the intersection of nonprofit organizations and public policy on individual health outcomes.
At the public policy level, if the food waivers for summer of 2022 were discontinued, then there would be an extra strain or hindrance on community and nonprofit organizations such as End Hunger Durham to provide healthy snacks and meals for students. This lack of healthy foods would then impact social networks such as families, especially if parents work multiple jobs and cannot provide homemade meals. This could increase reliance on fast food restaurants, which would then, at the individual level, lead to an increased risk of diabetes, hypertension, and increased vulnerability to non-communicable diseases.